We are now in week 11 of the Iowa legislative session with a lot of discussion happening in both chambers. One of those topics of discussion is possible changes that could be coming to Iowa's public assistance programs. Local 5's Larissa Leone has more on the bill looking to alter certain Medicaid requirements. Larissa.
Stephanie, Medicaid was the topic featured in Governor Kim Reynolds' Condition of the State address. Now, a bill that passed the Senate in a 33-15 vote is aiming to rework requirements for Medicaid and other state public assistance programs.
During this year's Condition of the State address, Governor Kim Reynolds shared her intentions to alter Iowa's public assistance programs like Medicaid.
I'm proposing that Iowa apply for a federal waiver to institute work requirements for able-bodied adults on Medicaid. In other words, if you can work, you should.
Now a bill filed in the Senate is aiming to get closer to Governor Reynolds' goals. The bill outlines changes to Iowa's public assistance programs, including implementing work requirements for the Iowa Health and Wellness Plan, where members must work 80 hours a month to maintain eligibility, with certain exceptions. A step Republican Senator Clemish says helps better Iowans.
By requiring work, we are providing an important stepping stone to help Iowans develop the life skills, build responsibility, and regain a sense of purpose.
Democratic Senator Peterson says this is a Medicaid repeal bill in sheep's clothing.
This bill requires the department to discontinue Iowa Health and Wellness Plan, kicking all 181,000 Iowans off of their health care insurance.
Taking a look at the lobbyist declaration, very few are supporting this bill. The Foundation of Government Accountability Action has declared they are in support of the bill. We reached out to the organization and they have not gotten back to us. Those among the long list of opposition is Mary Nell Treves with the Iowa ACES 360. She explains the main reasons she does not support the bill.
This has happened in other states, and unfortunately it hasn't led to increased workforce participation, but it has increased costs to the state as well as increased the number of people who are uninsured.
Now, the bill also calls for Iowa's programs to align with federal work rules and sets up a new fund to modernize the Department of Health and Human Services technology. Plus, it updates eligibility rules for Medicaid for employed people with disabilities, allowing individuals to disregard up to $10,000 in resources and couples up to $21,000 when applying. After being approved in the Senate, the next stop for this bill is the House. Stephanie?